Our next guest wants to empower women to embrace the change. Her name is Dr. Sharon Malone. She's an OB-GYN and the chief medical advisor of Alloy Women's Health. In her new book, I love this book, it's called Grown Women Talk. Great title for this. She gets candid about aging, and she urges women to advocate for your health without shame. We're very glad to say Dr. Sharon Malone joins us first on CBS Mornings. Good to see you, Dr. Malone.
Morning.
Thank you. Thank you for having me.
Can I tell you my favorite line in the book? Because there's so much more to this book than menopause, and I want to hit that. But my favorite line in the book is, menopause, on page 242, is mandatory, suffering is not. Please explain exactly what you mean, because many people think, well, we're going to suffer it. It's just a necessary evil that comes.
Exactly.
Not true.
Exactly, and that is true, because menopause is the one inevitable common experience that all women will have. If you're born with ovaries, you will go through menopause.
Yes.
But I think that what we've got to do is explain to women, just because we go through menopause does not mean you have to suffer. We have many options for how to treat it. And I think that as women, we sort of have incorporated the language of suffering into our existence. And I'm here to say we're done with that.
Yeah, we are still vibrant, we are still vital, and still important. The thing I like about this book, Sharon, is that every chapter you take us through a roadmap of our bodies, if you will. Because you said medicine is not built with women in mind, but your book is built with women in mind. You take us on a roadmap through our bodies, and you give us concrete advice for everything that happens in our life. Because you say we are in control of our destiny and in our health. True?
That is true. And as in today's world, we have never been more in control of our destiny. Because I think that the notion that your doctor was going to take care of you and advise you, that's no longer going to be the experience for most women. We're going to have to realize that we are in control of our bodies and how we access care. But you need to know how.
Yes.
And that is really what my book was about, to give you some concrete advice and a little humor here and there about how to navigate this period. It's confusing.
Let's talk about the early signs of menopause. Perimenopause is something in the book, and you say every woman by age 40 is starting to feel some of these signs. What are they?
Well, yes or no. Yes and no.
Okay.
I would say every woman by the age 40 should at least be thinking about it.
Okay.
Whether you're going to have the symptoms or not. And there are 34 symptoms. The most common that women think of are hot flashes, night sweats, mood swings, brain fog. The list goes on and on. However, you need to be aware of them, because if you don't know that this is all part of a process, a transition, then you will go to an endocrinologist because you gain weight, or a neurologist because you think your brain fog means something else. Just understand it's all part of a pattern that you should at least be aware of by the time you're 40.
Smart.
You also talk about the impact of stress, especially on Black women. You share your sister's story in the book. Why did you feel that was
And your
important?
mother's story.
And your mother's story.
Yeah. I mean, Vlad, I'm a Black woman who grew up in the South, and as did my siblings. I'm the youngest of 8 kids. And they led very stressful lives. And my sister Vivian integrated the University of Alabama in 1963, and I shuddered to think of how alone she must have felt, and the stress, the real stress of wondering whether or not someone was going to shoot you or blow up your building.
Yeah.
She lived with that for all the years she was in college and many years thereafter. And I think that the price that we pay for chronic stress is a high one. And it takes a toll, not just on us mentally, but it takes a toll on us physically. And until we deal with that, we're going to continue to have bad health outcomes.
We just wanted to tease people with the book because it's so concrete. Genetics is not your destiny. Your doctors should work together. You know, that's something I'm thinking about changing because of this book. And you just give everybody a roadmap, really, on how you can do better, be better. We are in control here. Sharon Malone, congratulations. Congratulations. Grown Woman Talk is out today wherever you like to buy your books.